And I am here today with
Dr. Carrie Scarff, PhD audiologist at Audiology Innovations in Calgary.
Excellent. So today I'm going to get my hearing tested so that everybody understands what they're walking into and can feel a little bit more at ease when it's time to get your hearing checked. So Carrie, let's get started.
Great. So Heather, what we usually do when we start an appointment is we bring our patient into our consultation area and we sit down and we ask them a little bit about any concerns they might have with their hearing. For example, places where maybe they feel like they're not hearing quite as well now as they were a few years ago. So I'm going to ask you that as an example. Heather, are there any places where you feel, it's a little harder these days for me to hear as well as I'd like to? Yeah, so let's go back to a couple of the things you mentioned. And as you can see, like even when you're a child, you can have issues that are happening in your ears that might affect your hearing. So I think that's one thing to share with the audience, is that hearing loss and ear issues can affect us at any age throughout the lifespan. It is more common with every decade of life. The ears do wear down over time, but certainly there can be ear and hearing issues at any age. Okay, so you had to have your eardrums, you had to have probably a little day surgery so that you could release pressure in your eardrums. Have you had to do that as an adult?
No.
No, okay. And then I'm looking on your form, and this is one of the things that we will often talk about with our patients, which is you mentioned you have a little bit of ringing or buzzing or humming in your ears. It's a very common symptom of hearing loss, just so you know. Tell me a little bit more about how frequent that is and how bothersome that is to you.
I think there's always been a little bit of ringing, just kind of in the background. I don't notice it as much until the power goes out, because then you don't have the fridge humming or all that stuff. And then it comes and goes, and it can be in either or in the ears. It just comes up and then it just goes away, and there doesn't seem to be any reason specifically for it.
Okay, so just to share with the audience some information, about 80% of the population gets what we call tinnitus, or you can pronounce it tinnitus, it doesn't matter, from time to time. And it sounds like that's what you're experiencing. But for some people, unfortunately, it can be very, very much more frequent and very obtrusive, to the point where it interferes with their hearing during the day, and certainly at night when, as you mentioned, there aren't those other distracting sounds to cover up that tinnitus. So if that's something that people are experiencing, it's a symptom and a sign of potential hearing loss, so they should definitely come in for a hearing examination. We're going to move to a few other things that we would normally ask people about. So I want to mention one of the most common places where people have difficulty with their hearing is actually in a noisy place. Like you mentioned, I asked you, I said, where do you have trouble hearing? You said, one of the things you said was in a group in a noisy place. So tell me a little bit more about what happens if you're in that kind of scenario.
Yeah.
Just going along with it. Yes.
Yes.
Okay. I have another question. Do you find you're tired after those kinds of situations?
Yes.
Yes. Okay. So that's important to know too, because most people don't realize this, but if we have some, even a little bit, a slight or mild amount of hearing loss, and we go to a listening situation where it's much harder to hear, guess what has to pick up the slack if our ears can't help us? Our brain. And so it becomes more fatiguing, and for us to strain, for us to have to focus and do all of those things. So that can also be a sign or symptom if you are starting to feel like, oh, I don't want to go out to that kind of group situation because it takes a bit more energy and I feel a bit more tired. So that's also a sign or symptom.
Okay.
You mentioned something else that was really important. You said things aren't necessarily as clear as you would like them to be.
Yes.
So we will do your test and we'll find out your results, but that is a sign or symptom of hearing loss, is that you feel like you can hear but not understand everything quite as clearly as you used to. Okay, so those are things we'll touch on after we go about the test.
Hi everybody, we are going to start our testing right now. So we're going to do something called tympanometry. Did I pronounce that right?
That's correct.
Excellent.
Okay, so this first test is completely automatic. You don't need to do or say anything. And the purpose of this test is to measure the pressure in your ear and to make sure that the eardrum is moving properly.
Okay.
So you might feel a slight pressure like going up a plane, but no more than that. And then you hear a few loud beeps, but it's going to be very, very,
So all you're going to hear is some humming, and then there's going to be some beeping. Super easy.
And that's tympanometry.
That was easy.
Alright, so for the next test, I'm going to get you to have a seat in the booth on the chair
Okey-dokey.
behind you.
Let's go. Okay, I'm in the booth. It's very quiet. I'm excited. Let's do that. So what's going to happen?
Okay, so what's going to happen now is I am going to put some foam inserts into your ears,
Okay.
and I'm going to give you a button. Then you'll hear some beeps. They're going to get softer and softer. And every time you hear a beep, I want you to push the button.
Okay.
Even if it's very, very soft and you're not sure you hear it, still go ahead and push the button because I'm looking for the softest sound you can
Okay.
hear.
Perfect.
Okay, so I'll be clipping these on your shirt.
Tickles a little, but it's all good. Oh, my button. All right. We closing me in?
Yeah. So I'll close the door, but we'll be able to communicate through the booth.
Perfect. Right. See that little window? We can talk to each other and see each other. So let's just go like this. Got my little button pusher. Yes, I can. Yes. All right. Pushing the button when I hear things on the right. Going to the left here. We're done.
That was quick and painless,
That was
wasn't
easy.
it?
Thank you. So easy. So just had my test done and we're going to take a look at the results. Doctor, how did it go?
So it went really well. You have very good hearing for all the different notes of sound, and that's shown on that picture behind me. So you'll see a red line and a blue line, and they're up towards the top of the graph. That's good news. That means you can hear most sounds really quite easily with too much difficulty. So that's great news. But let's say that you showed up and we did a test and there was some hearing loss.
Okay.
Then we would actually follow up with some additional tests to see what kind of hearing loss you have, if it's affecting your ability to understand words and to listen correctly in noise, for example.
Okay, perfect. So how long would an appointment like this usually take if there was some hearing loss?
So if someone has hearing loss, we set aside at least an hour to talk with them in detail about their history, do a thorough number of different kinds of tests. You've seen a few of them, but there are some other ones too. And then to explain the results and, most importantly, give them some recommendations to help them depending on what kind of hearing loss they have.
Okay. Quick question, because we were just in the booth. If somebody is feeling claustrophobic, how do we deal with that?
That's a great question. So sometimes we can use special ear pieces. They're the ones that we used with you, actually. And then we can leave the door slightly ajar so that they feel a bit more comfortable. Because just by putting the earpieces in the ear, that helps reduce some of the sound exposure.
Okay.
Also. Yeah.
Okay. That's
Yeah,
great.
we've thought of pretty much everything to make the testing as easy and comfortable as possible.
Yeah. Yeah, no, that was super simple. And you guys are so friendly. It made it wonderful. It was great.
Okay. Thank you.
Awesome. Okay, so if you did have some hearing loss, they are going to try and figure out exactly what it is that you're struggling with. So we are going to do, I believe you called it speech testing?
Yes.
Excellent. So we're going to do some speech testing. Okay. Okay. Boat. Pool. Nag. Limb. 100%. It does.
Okay.
Excellent. Okay, so I just did the word test, and Dr. Scarff is now going to tell us what that means.
Excellent. So it's important to know how well you hear different notes or tones of sound. But of course, we don't walk around listening to notes or beeps like you were listening to when you're doing the first test, pressing the button. So it's important that we do some what we call speech understanding testing. And we want to find out the softest level of words where you can hear the words correctly. And that gives us lots of good information about what's happening not only at your ears, but if maybe you've had hearing loss for a while and it's starting to affect your brain.
Oh.
So your test results looked very good.
Excellent.
If we saw some problems there, we might do a few more tests along those lines. And then we may recommend some different things to help people to get on top of their hearing loss right away, because if we're seeing those kinds of concerns, it means they've probably had hearing loss for a long period of time.
Okay, and then in the presentations that we have done in the past, you talked a little bit about how the lack of being able to hear affects your brain and its interaction with dementia.
Yes.
So share a little bit of the importance of why you need to be able to hear.
Absolutely. So a good way to think of it is your eyes and your ears are two windows to your brain.
Okay.
And if you're not getting the correct information in either, you're not stimulating that important brain muscle.
Right.
And we know it turns out that hearing loss is the highest modifiable risk factor for dementia.
Okay.
So what does that mean? It means two things. Number one, if we have hearing loss and don't do anything about it, it can affect our brain. But number two, it's modifiable. So in many cases, most cases in fact, we can do something about it. So we always recommend at the earliest signs of some hearing loss, people go and get a thorough professional hearing care in a professional clinic such as ours.
Such as yours, perfect. And that helps to maintain cognition as you continue to get a bit older?
Absolutely. So if you have hearing loss and don't do anything about it, imagine it like you're walking around your world with your ears partially blocked with your fingers.
Right.
You're not getting all of the information up to your brain, so it's harder to encode memories. It's harder to hear the right thing. It makes you potentially less confident when you're going into group situations. You might want to withdraw and not do some of the great activities that you guys have available through Unison. And that we know social isolation is really critical. It's not good for brain health. We learned that certainly through the pandemic.
Yes. And if you're not able to join us in person, the best part of watching and doing everything with us online is that you can turn your volume way up, and you can also put on your closed captions. So make sure you join us for all of our online programs. Do we have anything else on the agenda for today?
No, that's everything.
See, that was easy.
Yeah.
That was easy, and it was quick. You should get your ears checked.
Absolutely.
Thank you so much. I really appreciate it.
You're welcome. My pleasure. Yeah, we hope to see some of you in one of our clinics very soon.
Yes. Get your ears checked. Thanks, everybody.